Did you know that nearly 14 million Americans are enrolled in a Medicare Supplement plan, and that enrolling in the right one can save you thousands of dollars in healthcare costs? Now, in today's video, we're going to talk about the best Medicare Supplement plans for 2025 and help you make a better informed decision regarding your healthcare coverage. But we know health insurance, and Medicare specifically, can be very confusing, and it can be overwhelming trying to decide between the various Medicare Supplement plans, which can lead you to gaps in coverage. So we're going to break down the different types of Medicare Supplement plans, the benefits offered, the costs, and what you need to consider to choose the best Medicare Supplement plan for 2025. A Medicare Supplement plan is designed to fill in those financial gaps of original Medicare, namely things like deductibles, copays, and coinsurance, and sometimes they may even impose an out-of-pocket maximum, which is not offered by original Medicare alone. It's crucial to find a plan that aligns with your specific health needs and financial needs. Now, failing to do so can place a financial burden upon you that may make it more difficult to enjoy your much-deserved retirement years. By understanding the ins and outs of Medicare Supplement plans, you'll be better equipped to make a better decision regarding your health coverage. So let's talk about some of those out-of-pocket costs. So for original Medicare, yes, you have to pay a monthly premium, usually just for Part B. People don't usually have to pay for Part A. But when you actually utilize your insurance, there are out-of-pocket costs as well. And that's where those Medicare Supplement plans will step in to fill in those financial gaps. So as I said, usually no premium. For the Part A deductible in 2025, that's $1,676. Now that is not applied per year, but rather per benefit period. So if you have to be hospitalized more than once in a given year, then it's entirely possible that you may have to meet that deductible more than once in a given year. So that could be a potential out-of-pocket cost. Then there's your actual coinsurance or copays when utilizing your Part A care. So if we're talking about inpatient for days 1 through 60, there's no copay or coinsurance. Days 61 through 90, it's $419 per day. Days 91 through 150, it's $838 per day. And after 150 days, you pay all costs. So again, those are some potential costs. Skilled nursing facility, days 1 through 20, that's $0. Days 21 through 100, $209.50. And past 101 days, you pay all costs. Now, 21 days, that's just 3 weeks. Think about how long it might take to recuperate from something like a hip surgery or a knee replacement. Home health care, $0 for covered home health care services, 20% of the Medicare approved amount for durable medical equipment, and hospice care, there's no charge for. Then there is Part B. Again, we already talked about that there is a monthly premium. Your deductible, unlike Part A, this is a once annual deductible, and in 2025, it's $257. So that is not necessarily as significant a cost. When we talk about the more significant costs, usually we're talking about Part A because that's your hospital care. So those charges are just going to be more significant. Now for general costs, then usually it's 20% of the Medicare approved amount. Now for something like a doctor's visit, that's probably not very expensive. But when we're talking about X-rays, MRIs, diagnostic services, etc., then 20% can be significantly more expensive. Also 20% for outpatient mental health care, just pretty much across the board. When you use Part B, it's 20% of the Medicare approved amount. Now, many seniors are unaware of the differences in the Medicare Supplement plans. Some offer more comprehensive coverage than others, with varying levels of benefits. And understanding the key differences between these Medicare Supplement plans will help you to make a more informed decision regarding your healthcare coverage. This can help you to save thousands of dollars on healthcare spending in retirement. When selecting a Medicare Supplement plan, it's crucial that you take into consideration your lifestyle, your budget, and your healthcare needs. Do you have any pre-existing conditions that would require you to see the doctor more frequently? Are you someone who perhaps is interested in foreign travel exchange? Do you know in advance that you have planned procedures? Now, of course, this is not always the case. It is very hard to look into the future and imagine what our health needs might be, but at least having a basic understanding of where you are now versus where you think you might be is very helpful in choosing a Medicare Supplement plan. Because remember, it's not easy to change from one Medicare Supplement plan to the next. If you choose to enroll in a Medicare Supplement plan outside of your initial 6-month window, that would be the 6 months after you turn 65, and enroll in Part B, then you may be subject to medical underwriting. That means you could be charged more or denied. So you need to not only select a plan that's suitable for your needs now, but in the future as well. So yes, we need to talk about which of the 10 available plans is best suited to your needs, but also which carrier. You want to make sure that you go with a carrier that has a history of lower, more stable rate increases, because yes, those Medicare Supplement plan premiums do tend to increase on a yearly basis to accommodate for inflation and rising healthcare costs, but some carriers have a history of a lower, more stable rate increase as opposed to more drastic or sharp rate increases. You also want to select a company that has a history of good customer service and easy processing of claims. We'll get back to that in just a minute, but first let's take a look at the plans. But before we do that, a brief reminder to please like this video and subscribe as well to stay up to date. We do release these videos on a weekly basis, and liking this video or leaving a comment below will help to make it more visible to others looking for the same type of information. Now, if you have questions about your Medicare or health insurance in general, you can reach us in the comments below, but you can also reach us at the number on the screen. We are licensed health insurance brokers and we're licensed nationwide. There's absolutely no charge for our services, and of course, we work for you, not the insurance carrier. So we can serve as a third-party liaison if you have any questions or concerns during enrollment or even thereafter. All right, let's get back to it. This is the updated comparison chart for Medigap in 2025. Now, the benefits don't really change, but some of the numbers that we're going to discuss in just a minute do. There are 10 basic plans to choose from. Plan F and Plan G also have a high deductible version, which we will talk about as well. Now, not all of these plans are available to new enrollees. Namely, Plan C and Plan F are no longer being offered to new enrollees. And of course, these plans have varying price points and varying levels of coverage, which you can see. So a check mark, of course, indicates that this benefit here on the left is offered by this plan. You will see sometimes it's asterisked, or in the cases of Plan K and Plan L, which are cost-sharing plans, Plan K will cover 50% of the copay or coinsurance associated with that benefit. Plan L will cover 75% of the copay or coinsurance associated with that benefit. So let's start. Part A, coinsurance and hospital costs up to an additional 365 days after Medicare benefits are used up. Now, as we've seen when we looked at the Part A hospital costs for inpatient care past 60 days, you can see that all of the plans will cover that, and that can be a significant cost. Part B, coinsurance or copays, that would be that 20% that we looked at. Then all of the plans are going to cover that to some extent. Again, Plan K and Plan L only covering a portion of that coinsurance or copay. You will see here that this is asterisked. And that is because Plan N pays for 100% of the Part B services, except for copays for some office visits and some emergency room visits. So sometimes you may have an additional copay not covered by Plan N. It's not really going to be a make it or break it factor when deciding between Plan N and Plan G, which we will talk about later in the video, but it is something you should be aware of. Blood for transfusion, covered by all plans. Part A, hospice care, coinsurance or copays. Skilled nursing facility care, and as we talked about, if you stay more than 3 weeks, those costs can be rather significant. All plans except for A and B will cover that. Part A deductible, that one is huge. All plans except for Plan A cover that. There's a reason Plan A is definitely not one of our favorites. And very often you will see that it's not like the monthly premium is so much less. So there's usually not really a reason to go for Plan A. Now, the rest of the plans will cover it to some extent. Plan M will only cover 50%, and Plan K and Plan L, still those cost-sharing plans. The Part B deductible, that is a smaller figure. It is applied once annually, and no plans being offered to new enrollees will cover that. So the only plans that ever did cover it were C and F, and those are slowly being phased out. Part B, excess charges. So these are basically excess charges that can be charged by certain doctors. When your doctor agrees to contract with Medicare, they agree to accept the amount that Medicare will approve. However, doctors can choose to charge up to 20% more than that. And that's what's known as a Part B excess charge. Now, none of the plans will cover that except for Plan G and Plan F. Again, Plan F not offered to new enrollees. So if this is something that's very important to you, then you want to go for Plan G. That being said, Part B excess charges are not that common, and they're not even legal in all states. So again, this is not a deciding factor. For a travel emergency, all plans will cover that in some capacity except for A, B, K, and L, and then there's an out-of-pocket limit. So the cost-sharing plans will impose an out-of-pocket maximum. For Plan K in 2025, it's $7,220, and for Plan L in 2025, it's $3,610. That's because these plans are only covering a portion of the benefits, so you do need to impose some type of out-of-pocket maximum to ensure that your medical spending is capped in some capacity. The rest of them do not offer an out-of-pocket maximum, and of course, Original Medicare does not have an out-of-pocket maximum, but for a vast majority of these plans, most of your out-of-pocket costs are going to be taken care of by the Medicare Supplement plan itself.
Now, it's of course also important to take into consideration the costs associated with these Medicare Supplement plans. And of course, specifically, we're talking about monthly premiums. Generally speaking, those plans that have more comprehensive coverage may have a slightly higher monthly premium, but that could still save you money in the long run, which we're going to see in just a minute. Additionally, the carrier you choose will have a very strong impact on your monthly premium. Now, this is something that's very important to understand with Medicare Supplement plans. Although Medicare Supplement plans are offered by private carriers, it really doesn't matter who your carrier is. If your doctor accepts Original Medicare, then they will accept your supplement plan, regardless of who the carrier is. So don't feel that you need to go with a bigger name that perhaps you recognize, like Aetna or United Healthcare. You really just need to choose a carrier that has a history of lower, more stable rate increases. And that's again why it's very important that you work with a broker, because you want to choose a carrier that has that history of lower, more stable rate increases, a company that has a better reputation for customer service, ease of filing claims, etc. But before you can even get to that step, you of course need to choose which plan is right for you. And a crucial component of deciding which plan is right for you has to do with your budget. So let's run some of those numbers.
You can get a basic idea of what Medigap plans will cost in your area. And again, it is highly dependent upon the area in which you live, but there are going to be other factors that need to be taken into consideration as well as the carrier. We're going to see that in just a moment. So if I were not to put in any of this information, look at these price ranges from $94 to $1,600 per month, from $134 to $832, from $128 to $1,300. So these spectrums are just incredibly broad, which is why it's very important that you put in some basic information here. So I will put that we are 65-year-olds female who doesn't smoke. Update the prices. You still will see a range, but now it is a much narrower range. So Plan A from $94 to $296. As we saw earlier, Plan A is definitely not our number one or number two or even number three recommendation because it doesn't necessarily offer the most comprehensive coverage needed. So let's scroll down. The plans that I really want to talk to you about are Plan G, Plan F, the high deductible versions, as well as those cost sharing plans, and Plan N as well. Those are the most similar plans. Plan G, Plan F, and Plan N will offer you more comprehensive coverage. And then Plans K and Plan L, those cost sharing plans, can sometimes offer you much lower monthly premiums. So a basic Plan F, no longer being offered to new enrollees, could range between $117 to $378 per month. That being said, Plan F covers everything. So all you would do was pay your Part B monthly premium, and whatever your monthly premium for your Medicare Supplement plan would be, Plan F, and those would be your costs for the year, not including Part D. Plan F has also a high deductible version. And actually, let's scroll down to Plan G because that is more relevant to the topic of today's video. So Plan G can range between $31 to $55 for the high deductible version. It will cover all of those benefits offered by Plan G. So that's basically everything except that Part B deductible. And there is this high deductible version instead. So instead of the $257 deductible, your deductible would be $2,875. Now, is this for you? Is this not for you? Well, the monthly premium, very low. And it is going to offer you a tremendous amount of protection. However, you have to meet this high deductible first. However, you can really sort of think of that as almost being like an out-of-pocket maximum because basically Plan G is covering everything else after that point, right? It's covering your Part A deductible. It is covering all of your coinsurances and copays. So this is sort of the maximum that you'd have to pay in a given year plus your monthly premium. So it can be a great way to save money. If you have access to a plan that will offer you a much lower monthly premium, if you're somebody who's maybe in, better health now, looking to save a little money, again, you can't just switch willy-nilly at a later date, but this can be a great way to save money. If you were to compare it to the regular Plan G, you will have to compare apples to apples here and see what premium you can get with Plan G versus the high deductible version. Plans K and Plan L, we're looking at between $54 and $99 and between $94 to $154. So if you were to compare that to a high deductible Plan G, let's see. I think based on these numbers, I would have to run them more specifically, but I think you would probably come out on top because it looks like you still have access to a much lower monthly premium. So many of your costs are going to be taken care of already, and you have that high deductible. But as we just saw, your deductible, your out-of-pocket limit for Plan K is a couple $1,000s as well. So these might end up being more or less a wash. Plan L will have a slightly higher monthly premium because of slightly lower cost sharing and a lower out-of-pocket maximum. So I think based on these numbers, it looks like Plan G and Plan K could maybe be slightly more comparable, but Plan L will probably cost you more money. And then we scroll down to Plan N, ranging somewhere between $75 to $302, and that's covering everything except for a few copays here and there, and those Part B excess charges, which again, not very common. So what you would want to do is then contact the carriers directly because you'll see what their monthly premium is that is offered based on the carrier that you choose. Remember, if your doctor accepts original Medicare, they accept your supplement plan regardless of who the carrier is. So you can see what the approximate monthly premiums would be based on the carrier and the information that we've put in. You want to speak to a broker to make sure that the company that you're going with has a history of lower, more stable rate increases and that there's someone with good customer service so you're not constantly fighting with your health insurance carrier.
Now, the key takeaway here is that yes, although all Medicare supplement plans will help to cover some of those out-of-pocket costs, some offer better or more comprehensive coverage than others. And it's very important to understand the ins and outs of Medicare and Medicare supplement plans to make sure that you're choosing the right plan for your needs. As always, if you have questions, you can reach us in the comments below or at the number on the screen. As I mentioned earlier, we are licensed health insurance brokers who are licensed nationwide, and there's absolutely no charge for our services. And don't wait when it comes to enrolling in a Medicare supplement plan, because as I mentioned, you really only have 6 months to do so in most states after turning 65 and enrolling in Part B to ensure that you can enroll in any Medicare supplement plan of your choosing without medical underwriting, which means you could be denied or charged more. And before you go, please make sure to like and subscribe. We'll see you next time.